Hello, welcome to my channel. Today the title of my video is Pharmacology. This is part 1. Please hit the thumbs up button. Please share my video. Please hit the subscribe black button. I'm doing questions and answers are in Nclex examination. My first question: what are your 5 rights administering your medication? The correct answer: the right patient, the right medication, the right time, the right dose, the right route of administration. My next question is: when do you document your medication? When do you document your medication administered to the patient? And the correct answer is immediately. If it's not documented in a court of law, it was not given. You document immediately is the correct answer. My next question is: how do we document our pain medicine? The correct answer: you will document your pre-assessment. You will assess your patient, for example, your pain medication. Where is the pain? Location. On a scale of 0 to 10, how much your pain is? A 7. You document as you go along. What kind of pain are you having? A sharp, a throbbing pain? Is it dull? Is it radiating to your arm, your shoulders? You will do your pre-assessment documentation before you administer your pain medicine. Then you go for your pain medicine and you give it to the patient. You let the patient know what medication you're giving the patient. You're supposed to know the contraindication of your medication, the adverse effect of your medication. Patient is going to ask you about the medications. Then documentation will be next, will be your post-assessment documentation. If you gave your patient an oral pill, you return 1 hour and reassess your patient. Where is the pain now? Patient may say 0. If the patient said, well, it was a 7 when you pre-assessed me, now it's a 2. You document immediately. Where is the pain right now? Is it a throbbing pain? Is it a dull pain? Is it a sharp pain? Is the pain absent? You document pre-assessment when you administer the medication. And for oral medication, you document 1 hour for your post-assessment. If you gave IV medication, your post-assessment is 10 minutes after administration. You will return and do your post-assessment. The next question: if patient is unable to swallow oral medication, what do you do? Correct answer: you can, for example, Tylenol. If it's oral, talk to the pharmacist and see if they have the liquid form. If patient is unable to swallow the liquid form, have the patient NPO, nothing by mouth. Tell the doctor that this patient is having some difficulty swallowing. The doctor will order a speech therapist to come to the bedside and evaluate the patient's swallowing. The patient must be NPO until the patient has been evaluated by a speech therapist. Next question: before you give a blood pressure medication, what should you do? The correct answer: The nurse should check the patient blood pressure herself, not the tech. Check your patient's blood pressure. If the blood pressure is too low, do not give it to the patient. Notify the doctor why you're holding this medication. Next question. Doctor has given you an order to administer digoxin lanoxin. What should you know before you administer digoxin? Correct answer. You should check your patient's heart rate yourself. If the heart rate is less than 60, you will hold this medication and notify the doctor. Next question. Which medications needs 2 RNs to be a witness before administering it to your patients for safety? The correct answer is your heparin IV infusion, your heparin drips. Patient on insulin, you need 2 nurses to be witness for insulin administration. Patients who are on a PCA pump, patient control analgesic pump, PCA, with morphine, dilaudid fentanyl, we have to have 2 RNs as witnesses for these medications when they are administered by a PCA. Next question. A nurse administers the wrong medication. What does the nurse do? The correct answer, the nurse will do a head-to-toe assess. First, you assess. You do vital sign is an assessment. Complete vital sign. You will assess patient for LOC, loss of consciousness. You will assess patient for symptomatic distress. Call your doctor. If your patient is in any distress, just place 2 liters of oxygen on your patient. 2 liters is safe. Stay with the patient. Do not leave the patient if patient is in distress. Notify your doctor. Notify your doctor. For your information, Narcan IV is the drug that is used, PRN, in case of overdose of medications, morphine, dilaudid, fentanyl, PCAs, those patients. Next question is, patient refuses medications. What do the nurse do? Correct answer, the patient has a right to refuse. Assess patient. Ask patient, why are you ask patient, do not use why. Why is a block in communication. It's non-therapeutic. Assess the patient. Ask reason for refusal. Do some education. Do some teaching about the medication. The reason why it's ordered. Sometimes the patient thinks that the nurses are the ones who are ordering the medications. If you tell them the doctor is the one who orders it, give them some teaching why they need, 9 out of 10 times they will take the medication. If they refuse, document, notify your doctor. Patient refusing more PCA, morphine, dilaudid, fentanyl. What should the nurse do? Correct answer, nurse should teach. Do some teaching with your patient who's refusing the PCA. Let the patient know there is no reason to fear overdose. The medication is controlled. The medication is locked into the pump with a key, and there's no risk for overdosing. If your patient is supposed to get 4 doses of medication on the hour, if your patient press the pump 40 times, the patient will only receive 4 doses. There is no risk for overdose. Next question. What reason for open-ended communication when patient refuses medication? What is the reason for open-ended communication when your patient refuses medications? Correct answer. Sometimes after explaining, patient will take the medication. Do teaching with your medications before you administer all medication. Please note, sometimes your patients can be a nurse, can be a doctor. They won't tell you who they are on admission or discharge, but they can do a good write-up on you after they are discharged. So make sure before you administer your medication, communicate, open-ended teaching. Next question. What are the routes of your medications? Correct answer. Oral, IM, sub-Q, IV, ointment, patches, suppositories, vaginal, rectal suppositories. Some patients are given patches. For example, lidocaine patches for pain patches. Next question. How do we administer eye drops and eye ointment administered by the doctor? Correct answer. You'll administer your eye drops after, return 10 minutes after, and administer your eye ointment. A thin strip in the lower conjunctival sac from the inner canthus to the outer canthus. NEB treatment is administered for your patients with what symptoms? Patients who are wheezing, we give them NEB treatments. Example, patient with your asthma or COPD. These patients will get NEB treatments, for example, albuterol inhalation. Sometimes this is administered by a respiratory therapist. Next question. What is a stat order? Correct answer. Immediately. Administer right now. What are your single dose medication? Your single dose order medication, correct answer, is a one-time medication. Then the order is discontinued. What are your standing order medication? Standing orders, correct answer, is carried out as ordered by the doctor until the doctor discontinues the order. What are your PRN medications? Your PRN medications are, correct answer, as needed, not continuous. Please hit the like button. Please hit the thumbs up button. Please subscribe and please share this video to your classmates. Have a blessed day. Stay tuned to my next video. Stay blessed.